Welcome back to the Caribou Data Science Challenge. This is a continuing series on basic COVID-19 analysis using a spreadsheet, either Excel. I use LibreOffice Calc, but Excel should work. The command should be absolutely identical between the two. So first, I want to suggest that if you haven't started to already, uh, sign up for GitHub and use GitHub to manage all your projects. Several advantages: it makes it easy to organize projects, and of course, it also makes your project available from any machine, any internet connected machine. So as you can see here, I've already created one for spreadsheets. If I was to clone this, I would simply come down here after creating it, highlight this, and then see that I'm not using a RStudio. I can come here, document, even though it's not R, I'm keeping R for convenience. Get cloned this way, then command. You know what, let's do? Let's go back one and create a spread. Let's create a let's just call it, let's make a directory called spreadsheet. I don't remember how to make a I don't remember how to make a directory in a command prompt. So let's just do this. Spread. Okay. So there's two ways we can do this. We can go here, usually get clone, and come up here, use a GitHub repository, clone existing repository, source location, target directory. Let's see how this works. Okay, well, let's go do it the old-fashioned way. I don't think I actually have anything in there directory right now. Let's just check it and see. Okay, good. What we're going to do is we're going to find some data. We create a repository to store all the data. And for this demo message, because with Excel, you wind up, there's no separation, of course, between data and program. So let's do this. Let's see. So let's look for New York. I'm searching for New York Times COVID-19 data on GitHub. Here it is. So what I'm going to do, I'm going to come down there. I'm actually just going to do a zip. I'm going to unzip this. I'm going to put this, there's my data for tonight. There's one thing I wanted to take a look at. I want us to take a look at this probable cases thing. This is from May 7th. At the beginning of the COVID-19 epidemic in the United States, most health departments and Centers for Disease Control only consider a case to be confirmed as a COVID-19 with a positive confirmatory laboratory test resulting for the SARS-CoV-2 and RNA. Recently, however, more and more states and localities have started to include probable cases or deaths in their account. In some places, reporting only a combined confirmed and probable total. Because of these developments, we have changed our COVID-19 dataset to start including probable COVID-19 cases and deaths when they are available. It is no longer possible to report comprehensive confirmed only datasets. That's an interesting development. Okay, so let's come back over here now. Okay, and one other data set. I've looked at this one so much you don't have to type the entire string in. This is, of course, the European Center for Disease Prevention and Control. Uh, just as a side note, this database is a daily summary. I'll explain it when we get in there. While the New York Times and Johns Hopkins are cumulative totals to date. So there we got that now. So let's copy this. And this. Let's start here. Let's open this with a spreadsheet program. And as you can see, there's not a really lot of data in here. It's probably because I've actually already cleaned it out. Let's just change this to date. Or date. Consistent. Let's change this to this. That's good. Save it. Save it as ODF file. Okay. So the first thing we want to do is create a US COVID-19 database. Come back over here. Do a, autofilter is probably one of the most useful, function that both Excel and most spreadsheets have. And you'll see as we go along here exactly why it is so useful. I'm going to come over here, put my column headings in. I just call this countries for the sake of convenience. Now come back over here. You know what? This is come back home, come across here, come down, do a copy, and a paste. Now I got my basics. I'm going to go and get rid of this because we all know it's the United States. Let's come back over here, sort this by date. With this thing right there, I'm not sure why that's there. Okay, let's come back home. Let's start with our basic plots. Cases. Let's get rid of month also. Let's save. Let's plot cases and deaths. Line chart. So our elements. By day. X-axis is date. Y-axis is let's finish this. Now here's the reason I like autofilter. Here's the entire number of cases between January 1st and August 18th today. Let's do a filter on date. We want dates greater than or equal to. Let's try April 1st. And now we have, now we had a little filtered part. Let's come back over here again. Let's go even further with this, shall we? Let's start with the beginning of the current spike. You can clearly see that this spike began sometime in June with 20,000 cases a day in the U.S. Spiked on 7/23 at about 80,000 cases in one day. So that's helpful. But that's just dates. So let's get back to our initial thing. Now let's do a plot of deaths. Once again. Forward. So here's a little plot. Now we come back over again. Standard filter dates greater than or equal to. Let's start with April 4 again. And it affects both plots. So now we got deaths from cases from April 1st. See the spike in April and the bigger spike here. Then you see the cases with the spike in April continuing forward. Let's go once again. Let's go a little further. Let's do the 6th again. So once again, we can see cases from June 1st, death from June 1st. Here we are seeing an increase in deaths, but not close to this back here. Now let's just try something. Let's do a rough calculation of the death rate. Let me bring this all the way down. Do this. Let's do this again. Deaths divided by B2. Of course, that's 0, so we don't care about that so much, but let's go ahead and bring it on down anyway. So let's start over here. So let's start with so now let's do a plot of the death rate. Well, that's again, is a rough death rate. Probably, if you're serious, you probably want to take into consideration a incubation period. We could do we can divide the today's death by the cases 14 days ago. But this just gives us a little bit of just a little something to work with. Really, all it's about here. Standard filter, date. Let's try 4 first of all. Okay, if we look at it from April forward, the death rate did drop from 16% down to around between 2 and 4. Now, in theory, the difference between the spike of 16 and 4, let's say 2, is 14 points. So if we multiply difference in the death rate, that's a little bit too tricky for today here. I mean, technically, we should be able to subtract deaths from cases, and that's the survival rate. That's the estimated cases. So the question is this: how do we do a moving average? How do we do a moving average? Statistics, moving average results to So this should give us a, no, that's probably not correct. Let's see. Here's the question. Can we do So here we got the most basic plots that you can have, and the most important ones by day, with the ability to select the date range. So what's the overall news? Deaths are holding. Cases by day appear to be declining now. Deaths are holding. Death rate is down. So not hopelessly bad news, but that's it for this evening as far as the U.S. goes. Probably doing a second one here on the state of Ohio only, but this is your U.S. report. You can take it from here. Post the results. If you have any results you'd like me to see, post them in the comments below. I'd appreciate it if you would go and you would like and share this video, and also that if you would subscribe to the Caribou Data Science channel. That would help me tremendously. Be very encouraging to me. Okay, so thanks so much. We'll catch you on the flip side.